different from general history taking that we take in, other scenarios. Okay. So we will start with that. Shumali, do we have any slides for this, or we will just describe it briefly now?
I think just briefly discuss what areas we will see with that, right? In development, what is the focus more? I will share one pattern. I shared for autism, but this is not for autism actually. Just a simple history, how you will change your the beginning history which you were doing before, how the developmental histories changed from it. Just highlight few things, then one of them will take it so that we can learn few things.
Okay, so whenever you will have a command for history taking in the developmental station, so as we mentioned earlier, the area that you need to assess on physical examination, physical terms, you're not going to, go deeper in that area. Okay, and rest all the areas that we discussed, that is the other areas of development, all you have to explore so you can come to, the age of the child. Okay. So that will be the first part. So again, you will start the same way. Hi, I'm Dr. Madiha. I'm one of the kids doctor here in the hospital. Today I've been asked to ask some questions about Ali. Is it okay with you, mom? Then you are going to start it off. Okay. So again, same way, what are your main concerns? She will say, um, I'm concerned about his speech. He's not speaking much as compared to my other children. Okay. So the speech is the main concern. For example, if your command is to assess speech, then you will not go further in the speech, but maybe you can, just ask her a few more questions. Okay. So what are you concerned about? So she will say he's not speaking. He's speaking only few words. Then you will say, okay, we understand it and we are going to explore it. So let us just ask about some other milestones so we can, assess the child in a proper way, and then you will go to your gross motor. So again, as I told you, when you're going to the history part, please ask the first attained milestone on and what he can currently do. For example, if you're at a gross motor, the first major milestone is the neck holding or sitting. So you can ask, mom, do you remember at what age he had the neck control and what age he started to sit? Then she will say, yeah, he started to sit at 6 months. So it's fine. Then you will say, what can he do currently in terms of running and walking and in his activity? Then she will say, yes, he can run. He can climb upstairs. Then you can maybe ask one or two more questions. Can he? How does he go upstairs? Can you describe me the way he goes up? So of course, the examiner, he knows what you're asking for, so he will tell you the answer. Okay, he can go up in, with 2 feet together, or he's coming down like that. Okay. So this is enough for your gross motor. Then you will come to fine motor. Okay. In fine motor, what is the first milestone that generally comes? Anybody? The first,
Holding with both hands, like bidextrous grasp, no? 4 months.
yeah, that is. And before that, fixing and following. Fixing and following is also a,
Okay, okay. Vision.
okay.
Okay, okay.
So you can ask about this also. So, mom, do you remember when he started to make eye contact and when he started to follow you in the room? So he will say, yeah, at 3 months he was doing it. Okay. So that one. And then you can, of course, ask, can you tell me about the use of his hands? Then, the examiner will explain, okay, he is the, he can feed himself. Okay. So that is fair enough. Okay. Then maybe you can ask, if you give him a paper and a crown, what does he do with it? She will say he's only scribbling, or he can say that he's making, some shape. So you can ask these questions. So 1 to 2 questions from each area. Okay. Because you have to assess a lot of things in this station. Okay. Similarly, so now your gross motor and fine motor is over. What is the next station that you want to assess is social and play. Okay, speech and language is your command, so you're not going on that area. Okay, so social and play, you can ask, mom, can you describe to me how is he with other kids? Then she will say, yeah, he likes to play, he's interactive. Okay, or he doesn't like to play. And then you can ask a few questions from your social and social that we discussed. So you can, ask, For example, what about his toilet training? Okay, she will tell he's toilet trained or he's not toilet trained. Then you can ask, can he, handle himself
Dressing
alone?
also, yeah. How is he
Okay.
able to dress himself?
Yeah, can he dress himself? What about his dressing? What does he do in terms of dressing? So she will say he cannot dress. I helps him to dress, and but he cooperates. So he's 3 years. Okay,
Helps in
so you will
dressing.
ask, yeah. So helps in dressing. So two questions from each area you can actually ask and see. Okay. And then if it's not your command is not hearing and speech, then you will ask about the hearing and speech also. For example, any concerns regarding his hearing, then can you tell me what at what age he said the first word? Okay, at 1 year. Now what can he say in terms of speech? What do you think about his speech? She will say, oh, he's very talkative, he can tell stories, or he sings rhymes, whatever. Okay, so this is how you go about the history taking of the developmental areas. Okay, is it clear, everyone, how to ask these questions and to touch upon the first milestone and then the latest milestone?
Ma'am, please repeat about speech and hearing. There was some issue.
Okay, speech and hearing, it would again be simple. Okay, so you can ask mother about the first milestone of the speech. So what will be the first clear milestone that the mothers would generally remember? They will remember the first word. So you can ask, when did he say his first word? She will say, he's yet to say it, doctor, he hasn't said it yet. Then you can go back. So what does he do? What kind of a speech he has? He's babbling, he will say mama, dada, but he doesn't really mean it. So now you know that you are not going above, you will go back. Okay, so first you will ask about what was the first milestone according to the age of the child that is given to you. Of course, if it is an 8 months old child, you will not ask what was the real first word. Maybe you can ask, what does he say, what about his speech? So the mother will explain, he's saying mama, baba, dada, and you can ask, at what age did he start to do that? She will explain you, at around 6 months he started to babble and all. Okay,
And smiling
so
also, like smiling, he's following you, smiling, because the
mhm,
speech is both expressive and receptive. Okay, so you have to ask one from expressive and one from receptive.
yeah. So this is how you will assess the different areas of the milestones that are given to you. Okay. But of course, this is history taking. You have to assess other areas. So there are few list of questions that are extremely important in terms of developmental history. Okay. Because you think about the disorders that can cause developmental delays. What if I want to ask you guys, what are the different list of things that can cause developmental delay? Can you name some?
Cerebral palsy,
Okay.
behavioral disorders, neurological disorders,
Can you
syndromes,
name them, doctor? Some disorders that are
disorders
common?
like
Yeah.
autism,
Yes.
ADHD,
Okay.
and some few syndromes like Down syndrome, Turner syndrome,
Hmm.
and cerebral palsies.
Hmm.
Secondary may be due to encephalopathies or any XYZ anything.
Hmm.
What else?
Any
Hypothyroidism.
neurodegenerative disorders, also dystrophies, leukodystrophies, regression of milestone skills,
Yeah.
Rett syndrome, yeah. Fetal alcohol syndrome.
Muscular dystrophy.
Excellent. Muscular dystrophies,
Hmm.
hypothyroidism,
Then
lead.
any hemiplegia and like acquired later.
Yeah,
Hemiplegia, any trauma,
excellent.
post-traumatic.
Infections, brain infections, space occupying
Yeah.
conditions, developmentally delayed child because of that, chronic illness.
So now you, in your history, you will go directly to the questions that are related to these delays. Okay. For example, if you're thinking of a neurological disorder, what will be your questions? Write these questions down, memorize them, and just ask them. Okay. For example, you will ask about the head size, any concerns regarding the head size and shape, any marks or rashes, lumps and bumps on the body. Okay. This has to come in the history, okay? Then any history of seizures, trauma, regression of milestones, any abnormal hand movements, okay? So these questions will come, okay? Okay, so
It's
these
important also you have to mention about does he look his features look similar to the family? Is he look similar to the family? That is also important because this can be a syndrome. The other question is you have to specifically ask about any infection of the brain in this history systemic review when you are taking the review for all the systems, right? So in the head, increase and decrease in head size and any infection of the brain. Okay, any vision, hearing, abnormal movement, that will all come in the examination of the CNS or head. The questions for the CNS, questions for the head, that will come together.
Okay. So similarly, remember a few more questions like questions of hypothyroidism. Any concerns regarding his sleep, about his, eating, okay, weight, appetite. So just general questions. So you can assess whether this child is a case of hypothyroidism or not. Okay. What else would be the questions apart from that would be, recurrent ear infections. Okay. Because if a hearing delayed child is there, it could be because of the conductive hearing loss. Okay. So any recurrent ear infections. Okay. And I think these are the major areas that are generally there. So you just go through the list, and if you have any questions related to that, you can ask it straight away over here. Okay. So this is your systemic inquiry. Okay. Then when you'll come to the specific areas, for example, in cardiovascular, you can ask about color change, breathlessness, because, cyanotic congenital heart diseases can lead to, these brain abscesses, hemiplegias, and other things. Okay. They could be hypoxia that can lead to developmental delay. So now you focus on your history that is related to developmental delay. Okay. Similarly, in the chest, what can cause developmental delay? What things can cause? Maybe malnutrition. So you can ask about any chronic cough, any long-standing cough. Okay, so that will come there. Then when you go to abdomen, what can cause it? So of course, jaundice, abdominal fullness. You can ask. Okay, history of chronic constipation, that will cover you for hypothyroidism. Okay. So these questions are again, just think about the neurological things that you might be thinking of. Okay. And then when it comes to musculoskeletal, again, same thing. What can cause any neurological delay that is related to musculoskeletal? So that is Duchenne's. So any questions regarding that one? Okay, if you want to
If
ask.
any of you can just write the important question that is important in development history, specifically the general question and the systemic question, and put it in the group, it will be really good for all of you because this history is only for 9 minutes. So you can imagine how much important is it that you memorize the question and you don't forget any question. Even this recurrent ear infections, I remember every batch there was a recurrent ear infection was coming somehow in the history. So don't forget about it because it's so much related to it and the infection in the brain and every question is very important that will lead to your diagnosis that will help you. So please write down this question and put that paper in the group also. Any one of you can do voluntarily so that you guys don't miss on any of the question because it's just a 9 minutes station and the previous history session was 13 minutes.
So skin we already covered. So you see what general questions you have covered, and if anything is left from your systemic inquiry, you ask. So if we repeat the questions, what will be the questions? Once you've taken the developmental history, you'll quickly assess the systemic history, and in systemic history, you'll focus on the CNS history. Any change concerns with head size and shape. Okay, any history of head trauma, any infections in the brain. Okay, any history of seizures, abnormal hand movements, any change in academic performance. Okay, uh, these questions are
Hearing,
generally
vision,
regarding
yeah.
CNS. Yeah, any concerns with hearing and vision, and any lumps, bumps, or rashes, specific rashes on the body. Okay, then you can ask questions about, hypothyroidism. So you can ask about tell me about his diet and history of chronic constipation, any swelling in the neck. Okay, these three questions are enough. No need to, investigate further, because if there will be anything, you will get a clue in this one. Okay. And then again, you will go to your systemic inquiry, in which in the chest, ask for recurrent ear infections, long standing cough. In CVS, you ask for the color change, breathlessness. Okay. CNS, you already explored. Okay. Headaches, vomiting, all will come in that area. Okay. And then regarding the skin, you already explored. Okay. So good girl. So these things will be in your history taking station, and it will be very quick. You have to memorize them and you don't have to miss any question. So that is the most important part. That is why, as doctor is asking you, one of you can voluntarily write it and put it in the group. So we can also see if any more questions need to be added, and we can, you can, refer to it anytime, especially when you're taking history. You can keep this paper in front of you, take 2-3 histories while you are seeing the pattern, and then once you will be, inshallah, fluent with it, you can do it even without the help of that paper, right? Is it clear this much? Because tomorrow, inshallah, we are going to do the history taking, so we want you to follow this pattern, please. Okay.
So, I think we will revise inshallah as we go on taking the history. So we'll move on to the next also after the systemic review. What else?
Okay, so after the systemic review, what generally comes in the history is the past history. So you will quickly ask about the past history of any significant illnesses, surgeries, okay, hospitalization, and any investigations done. Okay. So she may tell you his hearing assessment was done or whatever. Okay. Or his brain scans were done. Okay. So you can take a brief review of that area. So then you will stick to the same history pattern. Okay. So that is this area, the HOPC was a bit different. Rest will be the same. So the HOPC should be very crisp, okay, in terms of your developmental history. Then after your past history will come your birth history. So now in this area, again, the birth history has a pivotal importance, okay, because generally the child that will be given to you will have some concerns on the postnatal and other things, okay.
What history you will take, and can somebody tell me about the birth history? What are the important points? Anyone?
Hello,
Yes.
can you hear me?
Yes. Yes.
So birth history, the few things that I wrote previously
Mm-hmm.
were details. I'll
Mm.
ask term, normal or C-section, and I'll
First go
ask
to
if the child was
antenatal,
admitted.
Conan. First go to antenatal. Antenatal is also very
Yeah,
important.
yeah. I just wrote all the points. So,
No, but you start with
okay.
antenatal, huh? Then because
Yeah,
if
yeah.
you will ask,
Yeah, yeah.
Mom, do you have any
Antenatal
infections?
pregnancy.
How was your pregnancy, right? So then you
Hmm.
will come out to the birth questions, right? Be
Yeah.
take it to
So,
structure the same.
okay. So you'll start with basically pregnancy. You'll ask if she had any complications during her pregnancy.
Hmm.
And then you will ask about the birth, and then you will move on and ask about details of birth. You will
Hmm.
ask about type of delivery.
Hmm.
Then if the patient was admitted, you will ask about brain bleed, delayed cry, and then discharge. When the child was discharged, you will ask about feeding. Screening test is very important here,
Hmm.
and heel prick test or screening test, whatever you want to call it.
Hmm.
And if the child was kept in any baby special units,
Hmm.
and details if the child was admitted, how many days, reasons,
Hmm.
investigations,
Hmm.
and then hearing and vision test.
Hmm.
If the child was yellow at home,
Hmm.
and if you feel like there's Down syndrome or something, then it will be very important to ask when the first poo and pee were,
Hmm.
birth weight, and then again postnatal, after discharge the child need to come back for any other issues or readmissions, and
Hmm.
especially brain bug is very important here.
Hmm. Anyone else can add
And
some
trauma.
points? Good. Very good.
Like
Mother,
alcohol, fetal
alcohol,
alcohol,
yes, and
Yes.
smoking as well.
Addiction. Yes.
alcohol and smoker.
Very good.
Then newborn period, any history of hypoglycemia, infections, antibiotic, gentamicin.
Hmm. Yes. So maternal history is also very important. So do give a focus for the antenatal. Any complaints? Were you compliant? What other medications mom was taking? Folic acid supplements. Are you regularly taking the supplements also during pregnancy? And were all your scans were anything being told? Anything specific? Any other condition? Sorry, it's a kind of a personal question. If you would please tell me if there was any addictions like smoking, alcohol, or any other history of taking any other drugs. Okay, so antenatal history you have to scan also. Okay, then definitely, as you guys told about the natal history. Okay, how was the birth? Can you describe it for me? And then specifically, you can ask about the postnatal, any infections during delivery, that anything significant that you want to mention. What about the routine assessment, hearing and neonatal assessment? Specifically, you can ask about that also if you think like it's a syndromic before you found out some of the features or some of the clues in the syndromes. Then when was he able to pee and poo, and was there any complaint with the feeding in the initial days? Was there any infections? Newborn hair screening test was done, heel prick test was done, and what are the results? That was normal. Are you aware of any other significant investigations being done? So that's why birth history is very important. Okay. What else? Then what comes next?
And again, one more thing, please ask open-ended questions. Don't be overwhelmed that, you have to ask correct questions, as we told before in the previous scenarios, okay? So mom, can you describe your pregnancy? So she will describe, I was okay, this, and about your health during pregnancy. Then she will say, okay? Then same way, describe the birth. And then after that, if the NICU course was there, don't directly ask, was there any brain bleed? Was there anything? So again, ask, can you describe what important events had happened during the NICU stay? Can you recall? Okay, she will tell, yeah, there was an infection in the brain. And if she tells you, then you can ask, how was it confirmed? What investigations were done? So you can be sure that what you're thinking is correct, okay? So you will have an idea, of course, that, he will be treated with antibiotics, and definitely some antibiotics must have been given that can you then cause,
Yeah,
hearing.
actually, what Dr. Jasmine has told about gentamicin, if she tells you at that time, he has a history of hospitalization, doctor, later, like at 15 days or 1 month of age, he has a history of hospitalization, then you have to dig out, was it confirmed? What was the diagnosis? What investigations and the treatment? Because some scenario was that he was admitted and he received gentamicin, and later on he had problems with hearing this thing. So the examiner asked in the end, what was the reason of this hearing in this child? What can be the reason? He has a history of neonatal admission, and at that time, prolonged neonatal admission, he was on antibiotics, and it's a confirmed meningitis with this lumbar puncture. How did they confirm that? So if there is a hospitalization history, then you have to dig it out. Depends whether you will get some information in the HOPC, or maybe the birth history also is important. You will get some clue in the birth history. What was the reason for the developmental delay?
And another thing, can we ask when did she feel the problem started? Can we ask like that?
Yeah,
Like
that I
whether
kept
to
it
know whether it.
in the end also, like when you will start with the history, what are your main concerns? Actually, at that time you have to the same way you ask about since when you have noticed this. Okay, so she will tell you the duration, and
So it will be
was
easy,
it
no?
getting
Like we
better?
can
Sorry?
know. No, then it will be easy now that whether it was from birth or she had any trauma or infection. So, like if it started at 2 years, then we can dig it out then. Otherwise, from birth, then some other cause. No? So, in the beginning itself, can we do like that?
In the beginning, you want to ask what?
No, when the problem started, like she says, okay, the child was having motor delay. Then we ask, when did it start? Like, was it from the birth or it started after 2 years? Like that, can
Yes.
we start ask her when it did? then it will be easy for us, no?
Yeah,
That
yeah, you
causes
have
will
to
be
ask,
like
because when you are presented with a complaint, that like you're asking about the presenting complaint, right? She's telling like the child has a history of delayed walking or there is a speech delay, and then you wanted to ask whether it started at birth. You will not ask whether it started at birth. You will start, when did you notice this problem first? As for any symptom which we told you, for any symptom you have to ask, na, the duration, like last 3 months, last 6 months, last 1 year. Okay? So you will get a little bit information there also. And if it's like started from the birth, usually it happens less because the birth part comes in the birth history. But definitely you want to get to connect the dots also. Maybe she has a super added problem. She has one problem that she noticed just now, and then there was another problem in the birth history also.
No, no, ma'am. Here I'm also having confusion. Like you are saying, she's having difficulty in speech. So, like as we are asking about all other symptoms, that when did this symptom started? When you did noticed?
Yeah,
So
you will
all
ask.
these questions we will ask
Yes,
or not?
question will come. This question will definitely come because you need to know since when she is having this concern. Na?
Okay, and after that, what we should ask?
If
It's
speech is the
associated.
area that you are going to assess, then you will not do anything for this. You will leave it. Okay?
We will not ask questions about this.
No,
No.
no. Then leave this because this is your assessment area. Na? If you'll ask questions, you will get a clue. Then you
Okay.
have to ask the relevant questions. For example, you will try to ask what is the issue, what are the concerns with the hearing. That you can ask. Is there any concern with hearing? She will say, no, I don't think so. Okay?
See, just as Dr. Madhya said in the beginning, you can ask only even one or two questions, not because once they will tell you to have to speech assess, and but when you are asking what's your main concerns, the mom will tell you the main concern is he's not speaking well. You can just put on okay. Because she told you some concerns, and as per our scenarios, we have to entertain her concerns, and then so you have to make a deviation of it from there, right? You, how will you turn your things from there? Like one question, even since when you have noticed, okay mom, we will definitely look into it. Can we explore some other areas also for him? What about his gross motor? Then you will ask, what about his walking, or when did he started this neck holding? Did you remember that?
Okay.
Is it clear now? So definitely these two questions, what are your concerns and when did you notice, since when did you notice that he is having these issues? That's it. If that is the
Only
same
the
age,
duration we have to ask. Only and only the duration we have to ask.
Yeah,
yes,
better.
that
Better only. Nothing, don't start with that because the examiner will get annoyed and he will say, I told you this is to assess why you are asking the history in this. Because it's clearly written in the guidelines, the area which they will tell you in assessment, you don't have to take history in that area.
Okay.
okay. Then after the birth history will come the vaccination and allergy. Sometimes, some people are saying we can omit vaccination and allergy, but some examiners, they want to hear. So better be quick and ask. Are there any allergies with any food or medicines? And what about his jabs? Okay, so quickly ask this question